You're welcome here if you have impacted tooth. Today's video is for people that have impacted tooth, where the wisdom tooth, the last tooth inside did not come out very well. So I'm preparing this for the treatment. This is a cotton wool with a toothpick, and I will be using it for my tooth because I have infection in my impacted tooth, the wisdom tooth by this side. I found out that it's swollen and it's very painful. So I'll be needing toothpick with a cotton wool, or you can use cotton bud for ear, but I prefer to use this because I add enough cotton wool on it. So the next thing I will do is I need hydrogen peroxide. Have you have impacted tooth infection before? You can leave your comments below. I would love to see them. So once in a while I do have this infection. I don't even know the cause of it, but this has really helped me a lot. This is hydrogen peroxide. All I need to do is just to take a little of it and then impacted tooth infection used to be very painful. As of yesterday, before I started this treatment, I could not eat. I could not eat solid something because it's always cold there and it pains a lot. And the pain was coming down here when I swallow, even if it's water or my spit. I'll have that sharp pain here in my ear and get to my eyes. So that's how it can be very painful. But this has really helped me. Now, what I do is I use the cotton wool and toothpick I roll it here, and I take this, I dip it inside the hydrogen peroxide and use it to clean that particular place. Yeah, I use it to clean it very well, thoroughly. Clean it for like 1 minute. Then when I clean it, you find out that it's foaming because hydrogen peroxide always foams. I'll try as much as possible not to swallow my spit. I'll hold it for 2 minutes, just 2 minutes. Then I'll spit it out. I'll spit out and clean my mouth very well. I do this like 3 to 4 times a day. And if the pain is too much, that you cannot bear it, you can just take, I just took paracetamol yesterday to release the pain, and also this morning to release the pain. But now I can talk. I feel better now. Just having this alone has saved me a lot. Saved me a lot from going to the hospital. So these are the things that I share in this channel: how to take care of your mental health, how to take care of your teeth without visiting the hospitals. The little things that you can do, just try as much as possible to do them. Remember, xylitol also is good for our oral health. Don't miss to go and get xylitol. You can get it in Amazon, you can get it anywhere, you can get it. So just search out xylitol. If it's a gum, if it's a mint, if it's a crystal that you get, it's very okay. You can use them to stop bad bacteria from affecting our teeth. So I usually use xylitol, but because of the impacted teeth, I am using this. In case if you are joining us now, this is a treatment that I use for impacted teeth infection. You know how it's painful it can be. Impacted teeth infection can be very painful, that you can't swallow your spit, you can't drink water, you can't even eat solid something, anything that you need to chew. Even if you want to chew it by the side, it will end up, you end up biting somewhere that is swollen, because it makes that part to be swollen. So this simple hack is the best treatment that I have seen. This is the best treatment I have ever seen. Someone told me about it when I was pregnant. A woman told me about it, so I decided to be sharing it to people freely, because it actually helps me that period. And yesterday I found out that I'm already having the pain again. I quickly rushed to get hydrogen peroxide. I always have it in the house. Hydrogen peroxide, cotton wool. I'll show you how I do it again. Just use cotton wool. Use it to roll toothpick. Just use it to get some cotton wool out from here. Roll it. Hope you're seeing what I'm showing you. This is how I do it. Roll it to get enough cotton wool here. Exactly. So when you roll it like this, get your hydrogen peroxide. And pour a little hydrogen peroxide here. Right, this is much. Let me choose it. So, impacted tooth. The solution that hospitals are giving us is to remove it. The last time I went to the hospital, to the dentist, they asked me if it was disturbing me. I told them no. Exactly, it wasn't disturbing me, because when the wisdom tooth, the last one, did not grow out very well, it tends to harbor bacteria, food particles stuck in there, and if it is not well cleaned enough, there will be infection there, and it will affect the gum around the teeth. So that is actually what causes this infection in that area of the tooth. So as I was saying that yesterday, I noticed the pains around there, and this is a treatment that I have been using to stop it, and it works very, very effectively. So once I dip this cotton wool here, you can see it's very wet. I'll use it to clean that area very well for like 1 minute. Clean the area, though it is very painful. I cannot be cleaning it right now that you are watching me, because I will not be able to be talking. Just clean the area with this solution. Almost everybody have this at home. In your first aid kit, you always have hydrogen peroxide. Okay, 3% is very okay. You don't need to dilute it, because you're not pouring everything in your mouth. You're just targeting one particular spot, which is the area that is paining you. So you use it and clean the parts that's impacted, that wisdom tooth area. Clean around the tooth and the gum. Make sure you clean it very well. Sometimes you'll be seeing maybe little blood on the cotton wound. It's a wound. It's a wound that is there. So this hydrogen peroxide is going to stop, cure the wound, heal it. Yes, let me just use heal it. So you clean that area very well. Once you clean it, you find out that it will begin to foam, because hydrogen peroxide always foams. So it foams and it's not painful. So you clean it around and it foams. I try as much as possible not to swallow it. I spit it out and I leave it there for like 2 minutes and spit it out. I give it some times, like 3 hours or 4 hours interval. I will do the same thing. Within 3 days, you are free from those pains, because the pains, when it's severe, you cannot eat, you can't chew anything. To swallow your spit will be difficult thing, because as of yesterday, it was difficult for me to swallow anything, even if it's water. It comes here. As of yesterday, I could not touch here. That's how painful this can be. I cannot touch this particular place, but now, as you can see, I can touch it. So the pain is reducing. It's going. And as of yesterday, if I swallow my spit, I have this sharp pain inside my ear and in my eye at the same time. So this is how painful this can be. And that's why I am helping a lot of people out there to give out this information, because many people are going through this, but they don't know that they have the solution in their house. They don't know they have what they can use to stop it. So it's hydrogen peroxide, and you use it the way I've showed you. Just clean that area very well. It is not an issue again. The pain goes in days. Let me just say 2 to 3 days, you are free from it. And if eventually happens, maybe in months to come, still repeat it. You don't need to go and remove your wisdom tooth because it's impacted and it's having infection. You don't need to remove it. And if you are prone to cavity too, make your best friend xylitol. Yeah, make xylitol your best friend because it fits the the bacterias there. It kills the bad bacterias and feeds the good bacterias. What I mean is that we have good bacterias and we have bad bacterias in our mouth. Yeah. So when you take xylitol, you're not actually swallowing it, though it's safe to swallow, but I don't swallow mine. Xylitol is very sweet. It tastes like sugar, and um, it's it's when you look at it, it's looking like sugar. The only the only difference there is that when you put it in your mouth, it has this cooling effect. It's going to be very as if you put ice inside your mouth. That is the only thing that you know that this is not sugar, that is xylitol. So I mean xylitol crystal. So if you have access to xylitol mint or xylitol gum, anything, or xylitol toothpaste, yeah, you can as well use them. Once you're prone to cavity, make sure you're using anti-cavity toothpaste, especially the ones that is made with xylitol crystal. Okay, it's going to help you to stop the growth of the bacteria in your mouth and to stop that cavity from proceeding, going deeper into that tooth and also spreading to another teeth, to other teeth. So this is just a tip for those that have cavity. Most people know cavity as tooth decay. When you see a black spot on your tooth, even if it's one part, by the center, by the side, don't just ignore it, because if you ignore it, it's going to go deeper than you can even imagine, to the extent that when you go to the dentist, they might want to fill the tooth for you. So it's very good that once you notice that spot, begin treatment immediately. Or if you're around people that are prone to cavity, you know that you're at risk of contacting it because it's contagious. It's 100% contagious. Once you're sharing utensils, your spoon, your fork, if your spouse is prone to cavity, that means you as well can contact it if your oral biome is not well balanced. So for it to be on the safer side, protect your mouth with xylitol products so that you're not going to contact it. And if you're a mother, you have children, kids that is still feed, we when we are feeding our kids, we tend to make use of the spoon, eat and give them. And that's how most parents share these bacteria to their younger ones, because you see a child of 3 years, 4 years developing cavity at that early stage, and you'll be wondering how come. You don't know that it's somebody that is nearby, or even you, that is giving them that bacteria. So what do you do as a parent if you know that you're prone to cavity? Give your children xylitol, not to eat, not to swallow, but use it in their oral care, like when they're brushing their teeth. You can give them, after brushing their teeth, they'll just switch it around their mouth and spit it out, and they go to school without drinking water. That's enough. They're well protected. They can't contact it. They can't. Because I know you don't want your children to go through the kind of pain that you're going through, at this their early stage. So do well to protect them, and also protect prevents the bacteria from getting to them. So for impacted teeth, like I said before, we'll be using, this is cotton wool. We'll be using cotton wool, and we'll be using cotton wool and toothpick. So we're going to use it to collect this cotton wool, roll it. You know, I was just imagining, is this how people that do cotton board used to, used to make cotton board? It's just as simple as this. Get as much as possible, as much as possible. Get it, like this. You're seeing what I'm doing, right? Very good. And make sure that your hands are clean, so you're not introducing bacteria into your mouth. So roll it up like this. I think this is very much okay. Yeah, and it's very neat. So the next thing that we need is get your hydrogen peroxide. Almost every house, you must see a hydrogen peroxide, because this is always in first aid kits. So hydrogen peroxide, this is how many percent? Okay, this is 6%. You can use 3%. Okay, use 3% hydrogen peroxide. All you do is so 3% hydrogen peroxide. All you need to do for you to stop that infection, for you to stop that pain, because that pain can be so painful that you cannot swallow your spit. Commonly your spit that you easily swallow without you noticing. When the impacted tooth have infection, it goes down to the throat. Like as of yesterday, I could not swallow my spit. Even if I tried to swallow it, I have to. The pain here was much that it gets to my ear and to my eye at the same time. So that's how painful this could be. If you have experienced this pain, just write in the comment section, because I know that you understand what I'm saying. For those that have not experienced it, should not even pray to have it, because it's so painful. So all you can do, just take a little of, you're not using much. This is hydrogen peroxide. So this is exactly what I do, how I do it. I didn't have this knowledge by myself. When I was pregnant with my first child, I met a woman when I was having pain, walking on the streets looking for, I thought I was going to get drugs. I don't even know the drugs I was going to, but I just needed something to relieve me that period. So when I met that woman, I told her they were selling one herbal drugs for teeth like that, and I was actually heavy pregnant. So I told her I'm having pains. So she knowing that I was pregnant, she doesn't want to sell that one to me, but she told me I should go and get this and do it. So that thing that she taught me has helped me a lot, and that is what I am showing you right now. So she told me to get hydrogen peroxide and use it around that place. So now here I have hydrogen peroxide, and this is cotton board, as in cotton wool. I rolled it here. So I'm going to dip it here. This is how I do it. Dip it here and use it to clean. I'll open my mouth and use it to clean the area. That's my last tooth down. That is where the infection happens, because it didn't grow out very well, and I have gum covering some parts while some parts are out. You know, this can be so funny, and can be so difficult to care for, you know, when you have impacted tooth. Food particles tend to stuck in there. Sometimes it leads to tooth decay. Now, when you have this pain, don't hesitate to do this, because the more you stay, the more the pain increases. I wasted time. This day was on Sunday. I wasted time before I did this treatment. That was why my own got to that extent. So with this hydrogen peroxide and with this cotton wool, just use it gently. Gently use it to around, clean around that place gently, because at this point you'll be feeling much pain that you will not want anything to go in there. But at the same time, you want the pain to stop, so you know how to manage it. Make sure it touches around those areas very, very well. Make sure that the hydrogen peroxide, use it to clean that area, because when you finish cleaning it, you find out when you speak out and look through the mirror, open your mouth very well, you find the place that is actually causing the pain. That place will have reddish. It's always small reddish something that is causing all this problem, not a big something. Well, it causes a lot of pain. So when you open your mouth and you see that place, next time when you're cleaning, you know where you are targeting to clean, okay? So that you will not cause much pain to the already existing pain. So that is how you can do this, and once you do this, you are free from a teeth infection, and you can keep your wisdom tooth. You know, hospitals are always telling us remove it, remove it, remove it, but I'm not a fan of removing teeth anyhow. I believe that each tooth has benefits. You know, they all have what they're doing. They need to be together intact so they can do their job very well. So I don't take advice of, you know, removing my tooth. The last time I went to the hospital, they told me the best thing for me is to remove that tooth. But I said no, I'm going to keep it. I'm going to keep it because I know how to care for it. So that's why I'm telling you this is the easiest way to care for your impacted tooth whenever it gets infection. And the next thing you will do when you're doing this treatment, remember to change your toothbrush. Remember to change that, but even if you just started to use it a day before, you got to change it, throw it away and get new one. So you'll not be introducing the same bacteria into your mouth after your treatment. So change that toothbrush, get a new one, throw away the bacteria, the infection that has entered your old toothbrush, throw it away, get a new one, and use this hydrogen peroxide 3%. Okay, use it to clean around that place. I didn't say you should pour it inside your mouth because hydrogen peroxide is not always good for mouth, but once in a while you can use it. For those that always use it to whiten their teeth. To me, I don't. It's not advisable because it has its own disadvantage. It might keep your teeth white, but what about the health of your teeth? So that's why I don't pour everything inside my mouth. Rather, I use small, something like this. Use it and target that area and clean that area very, very well. So when you clean it very well, you leave it will form. Don't bother, because hydrogen peroxide always forms. So let it form, let it stay there for like 2 minutes. Don't hold it for a very long time. Just 2 minutes is okay. And you spit it out. Spit it out, okay? Clean your mouth and allow your mouth to rest. Allow it to rest. Maybe in the next 3 to 4 hours, you can repeat it. Repeat this process so that the pain will be reducing, you'll be getting healing faster. And before you know it, the second day, the pain must have gone down very well. The third day, you must have been free from that sharp pain. So this is what that has been helping me, and I believe it will help you too, because it's better than going to the dentist to go and remove that tooth. Okay, and the impacted teeth, because it harbors food particles inside, because food particles tend to go and stay in there. It's makes bacteria go in there. Okay, it makes bacteria to go in there and grow, and that causes pains. Not just only pains, it causes cavity. Some people cavity started with that wisdom tooth because it didn't grow out very well. Most people cavity started from there because food particles stay there and they could not brush it out, and it stays there and begin to decay. So if thanks for watching. So if you are still on this channel till now, that means you're getting value. Thanks for watching, and remember to hit the subscription button, and also leave a comment for us. Leave a like and a comment for us. That will give us more encouragement. So impacted tooth infection, if you are here, that means you know what I'm talking about, how painful it can be. This is home remedy, what you can do by your own, what you can do on your own, what you can do at the comfort of your home to stop those pains. Okay, you know that pain can be so severe, can be so painful if you didn't start the treatment immediately. Most people don't know what to do. That's why the pain gets worse. So once you have this cotton wool, you have cotton wool or cotton bud, the one for cleaning ear. Once you have it and you have hydrogen peroxide, what are you waiting for? You don't deserve to go through those pains. No one deserves to have toothache. No one deserves it, because it's so painful that sometimes you can't swallow. Come on, swallow your spit. You can't swallow your spit. And here, like as of yesterday, because I didn't start the treatment on time because of one or two reasons. As of yesterday, I could not even press here, but now I can press it here. Here was so painful. I could not easily swallow spit, water. Talk more of eating. Eating yesterday was very difficult. So So this is exactly how you roll this. You roll it to get enough cotton wool. Make sure that your hand is clean. You wash it so that you'll not be introducing bacteria into your mouth. So once you finish rolling it, get this. This is hydrogen peroxide. Hydrogen peroxide. Almost everybody, you have this in your house because it's always there in first aid kits. So you have it. I believe you have it. If you don't have it, you can easily go and get one. Okay. So use this hydrogen peroxide anytime that your impacted tooth is having infection. You know that area where gum is. That area of the tooth that didn't come out very well. That is impacted tooth. Excuse me. They don't usually come out very well. Maybe half of the tooth will come out, while half will still be inside. And the gum on top of the that is covering the half of the tooth, sometimes it gets swollen, it gets infected, and when it swells up, it's very painful. So this is exactly what I do when I get this, and it doesn't occur every time. I can't even remember the last time this happened to me. So so this is hydrogen peroxide. Oh, this is much. Welcome back for those that are coming back, and welcome to those that are just joining. We are talking about how to care for our teeth, impacted tooth. That is our wisdom tooth, that the last tooth. It always gets infection if it is impacted. So this is how I do care for my own once I get it. Like once in a while, it do happen, not always. Like currently, I am having the pain there, and that is what makes me to bring this information to you. Like I got this information from a caring store when I was pregnant, and I was in pain, and I was walking on the street going to go and get medication. I met the woman. I told her that my teeth is paining me. She told me to go and do this, and I did it, and it worked perfectly. So if you have ever had impacted teeth infection, you understand how painful it could be. So you watch me as I show you how I do it. This is cotton wool, and this is toothpick that I used to collect the cotton wool to roll it up. Make sure your hands are clean, so you'll not be introducing bacteria into your mouth. See how smooth and beautiful it is. So to stop this pain and the infection, you know, it means that there is a wound on the gum around that um, tooth. It doesn't actually mean that is a tooth that is paining you, but it could be the gum, the flesh on top of the tooth that has injury. By using this is hydrogen peroxide. By using this to clean that area, here we always talk about your oral health, things you can do on your own to stop pains and to care for your teeth better. Most of the things that we use here are the things that everybody have in their own house. This is cotton wool, as you all know it, and this is toothpick. I just got one from here, and then the last so remember to like this video. Don't just pass by. Like this video and help many people to see this video. Impacted tooth can be so painful. If you have had infection on that area before, you will understand better the kind of pain that it causes. Like, you don't want that pain to come back again. But unfortunately, that tooth always gets infection. Maybe once in a year or twice in a year, depending on you. That particular place always gets infection, and that is why dentists always want people to remove that tooth. That's the last tooth, wisdom tooth. If you have impacted wisdom tooth, impacted means that it didn't grow out very well. Some people that are fortunate, their wisdom tooth, that's the last tooth, grew out very well. It comes out very well. Why some people that are unfortunate, do have impacted one. Have you ever have an impacted tooth before? Do you have impacted tooth? Or do you have impacted teeth? Mm? Do you? Do you have impacted tooth? Have you ever had infection on that tooth? If yes, watch me as I show you how to care for it. So this simple hack has saved me a lot of money. It has stopped the pains for me, and it has helped me a lot. So that's why I'm bringing it to my channel, because in this channel I share things about your dental health, things you can do, and so on for you to care for this your impacted tooth that has infection. What you do is this is cutting one, and this is toothpick. So I'm going to use it to get some cotton wool here and roll it here. You know, this thing has helped me a lot. The first time I had this impacted teeth infection, I was pregnant. You know, in pregnancy our oral health deteriorates. It goes down very well for those that are women and for those that are married people. Women's oral health goes down in pregnancy. So this is how to do it. Okay, rub it very well. I think it's okay. So get this. So many people are saying that they have used so many oral products, but it's not working for them. One oral product cannot work for everybody's problem. There are some that is specific for one, and some that are specific for others. Like for the one for cavity, will not work for gum, might not work for gum inflammation. So just take a little of this, a little, you don't need much, little, ouch. You're welcome to this live video. We decided to go live today, you know. Hope you're enjoying this live video. Give us thumbs up, give us thumbs up. We all deserve to have a healthy teeth without pains at any point in life. So just give us thumbs up, like this video, you know, for you to treat for that impacted teeth. It's just a simple something that you might not have imagined before. Just a little hack that if you have known it all this while, you know, you will not go through the pains that you have gone through, or probably right now you are having the pain. So if actually you're having the pain, this is how I treat my own. Maybe you can do the same thing, you know. So all you need is a cotton wool and a toothpick. Use it to roll the cotton board, or you can use it cotton board for ear, you know, that for cleaning the ear. You can use it and use hydrogen peroxide. You know, this mouth wound in the mouth needs to test somehow. So if you're having pain in your mouth and you notice that the taste of your mouth has changed, that means you have a wound somewhere. It's not necessarily going to be ulcer, mouth ulcer. If that pain is coming from the last tooth, that's the wisdom tooth. If it's coming from that last tooth and you know you have impacted tooth, what I mean by impacted tooth is if the your tooth did not grow out very well, maybe half of it is showing, is already outside, while half of it is inside your gum. Your gum is covering it. That is impacted tooth. So if you are having impacted tooth infection, that area that's gum, that area that gum is staying on top of the tooth is paining you, is swollen, you know, it's causing you uncomfortable. That means there is an infection there. It has been infected. So how do you care for it? All you need is just hydrogen peroxide and a cotton board. A cotton board, or you can roll it up like this. Take a little hydrogen peroxide. You can use a 3% hydrogen peroxide. Take a little. Take a little of it. So when you take a little of this, all you have to do is dip that cotton board inside the hydrogen peroxide to get enough of it, and use it. Open your mouth very wide and use it to clean that area very well. You notice that it will start to form. That is how hydrogen peroxide does. Use it to clean out the bacteria. Clean it out very well. Then leave it there for 2 minutes. Just 2 minutes is okay. Leave it there for 2 minutes. So when you leave it there for 2 minutes, after 2 minutes, you spit it out. Don't swallow it because it's not safe to swallow hydrogen peroxide. In fact, just with hydrogen peroxide. I believe you have hydrogen peroxide in your first aid kit. So you don't need any other thing, just use it to clean that place. Clean your teeth with hydrogen peroxide. Clean that area with hydrogen peroxide. Yes, just clean that area with hydrogen peroxide. Do it interval of 4 hours. I didn't say pour the hydrogen peroxide into your mouth. Sometimes it can burn, okay? It can hurt your mouth. But just use a cotton wool, dip it inside the hydrogen peroxide, gently use it and clean that area. At that point, it is very painful. You don't want anything to touch that area. But because you don't want the pain to persist, you need to clean it. So you endure the pain and you clean that area. Clean it very well. Clean the inside. If the gum that is there is shaking, try to fix it inside. Clean under that tooth that is impacted. The tooth that is impacted, some is out while some is in. So there is a gum that is covering half of it. Try to clean that area very well with this hydrogen peroxide that is in your cotton wool. After you finish cleaning it, hold the spit there for 2 minutes and spit it out. After spitting it out, open your mouth very wide and look into that place with mirror. You will see a spot that is reddish. That is a little spot that is reddish. That is a spot that is giving you that much pain. Very, very little spot. But the pains that it gives gets to the ear, gets to the eyes, even to the throat that you cannot swallow. So that's how painful this impacted tooth infection can be. But with this that I've shared with you now, can set you free from those pains within interval of 2 and 3 days. Do it consistently, and you don't need to go and spend money in the dental office. Dental treatments nowadays are very expensive, so anything that is good that you can do, that you can do to stop those pains, just quickly do it and be free. Take care of your teeth as you can. Use good products, especially products that is made with xylitol. Once there is xylitol in your country, search for those products and make use of it. You know why? I'll tell you. Xylitol feed good bacteria. In our mouths we have both good bacteria and bad bacteria. Yes, we have many bacteria in this our mouths. So what you use xylitol products. Either you are brushing your teeth with xylitol toothpaste or you are chewing xylitol gum. In fact, I don't think I can ever chew so thanks for joining me in this live session. It's eating up joy spending some time with you. I'll be saying bye for now. Please subscribe to this channel and join me in my next live section. See you in my channel. Join this family. All right. Have a beautiful day. Have a nice day. I love you all, and remember to care for your teeth because no one can care for your teeth the way you can. The dentists, they always encourage you, but you are the one that can care for your teeth. All right. See you.